You are listening to the Your Knee, Your Health podcast. I'm your host, Adam Rosen. I'm a fellowship-trained, board-certified orthopedic surgeon who specializes in knee replacement. Here I'll talk to you about common knee complaints and other orthopedic issues. We'll cover other important health-related topics, all of which are meant to helpfully answer some of your questions and help improve the quality of your life. Thanks for listening, and on with the next episode. Hello and welcome back. This is Adam Rosen. You're tuning into the Your Knee, Your Health podcast. In today's episode, which is episode 91, I'm going to talk just briefly about a supplement that may be helpful if you're having knee replacement surgery. I have a number of episodes coming up. I'm working on one where we're going to talk about fiber. I've touched on this briefly on some of my other episodes on health and wellness and good eating, but also want to talk about the importance of having a high fiber diet. A number of patients after surgery can develop constipation, but also the United States specifically has a high rate of colon cancer, and a high fiber diet has lots of health benefits. So we'll talk about that. I'm also going to be talking to you about suicide. I'm looking into this in a lot more detail, and I'm going to be working on this for an episode for my other podcast show, which is geared more for orthopedic surgeons, mainly those in training, because unfortunately with COVID, we've seen healthcare worker suicide rates go up, which is concerning when anybody decides to take their life. But we're seeing more and more of that in the healthcare field with what people have been going through. And then I'm also toying with, it's kind of almost like a teaser. I'm toying with sharing some information on some ideas that I have, which would be included in a book, which may be quite controversial. But I think I might start actually a number of episodes where I just kind of share with you stuff that I see in my job and kind of open your eyes and ears to, what goes on behind the world of medicine, because it's very much not like the TV shows that you see, like Grey's Anatomy and things like that. There are some things, but it's still very different in the real world. So without further ado, I want to talk to you today about a supplement called essential amino acids. And when we talk about knee replacement surgery, one of the important things to obtain a good recovery is, health and wellness, your nutrition, and specifically quad strength. I've talked about this before. If you have back pain, people don't rush into back surgery. They strengthen their core. And we talk about how you can strengthen those core muscles of your leg to support your knee, whether or not you have a normal knee or an arthritic knee, or you've just had a replaced knee. The problem is that when we do surgery and when we use a tourniquet during surgery, that can lead to atrophy of the muscle that is so important for you to recover well from surgery. But the problem that some patients run into is that because of pain, they have already cut back on their exercise or activity. They limited how they walk. You talk about people always dragging the leg or using the other good leg to go up and down stairs, or use their arms to get off the toilet or out of a chair. And all of those things over weeks and months and years can lead to more and more weakness or atrophy of those muscles. And then we do a surgery which makes those muscles even weaker. And then you have to do therapy to get up and go to obtain a good outcome. So that's why I stress with all of my patients the importance of strengthening those muscles before surgery, what we call sometimes prehabilitation or prehab. But even in patients that are doing these exercises, there's still going to be some loss of girth or atrophy of those muscles. So there was a study that was published around 2020, and this won a very big award from the Knee Society, which in this particular award is named after a famous orthopedic surgeon, Dr. Chit Ranawat. And this was titled Perioperative Essential Amino Acid Supplementation Suppresses Rectus Femoris Muscle Atrophy and Accelerates Early Functional Recovery Following Total Knee Arthroplasty. A big mouthful, but basically it's saying that if you use essential amino acid supplements around the time of surgery, it may prevent the weakness that you get in your quad muscle and also improve your recovery. Now, what was interesting is, I first heard about this when I read that article a few years back, but I was looking into this, and actually I found another article which was very similar study, although slightly less patients in the study, but done almost identically as far as two groups, a placebo group and a group that got the essential amino acids. Now, this group, they used a higher level of amino acids. The first group, it was 9 grams a day. This was 20 grams twice a day. And this older study looked at MRIs to look at muscle and tested strength, where the more recent study looked at ultrasound. But what both studies showed is that the group of patients that were taking essential amino acids for a week before surgery to 2 weeks after surgery, they had less muscle atrophy and improved mobility and function. And that's really important because, again, when we talk about the time after your surgery is so important to obtain a good outcome, that the clock is ticking the moment that you have surgery, that you want to do everything in your power to improve your range of motion and to improve your strength and to improve your recovery so you get a good outcome. Because you don't want to be one of those people, at a year that's still having problems and difficulties because they didn't have the most optimal recovery. And there's a lot of important things that go into the recovery after knee replacement, and this is just one of those. And when it comes to supplements, it's always hard because, there's a lot of supplements that you may not even need, that you just pee into the toilet and waste a whole lot of good money. But essential amino acids, this is now 2 studies that have shown that the addition of these essential amino acids may improve your recovery after surgery because it decreases the atrophy that you get without these. And it's hard because you can't even get all of these essential amino acids in diet alone. So supplementing these may be helpful. So if you're having knee replacement surgery, and especially if you're concerned that you're weak or you're looking to improve strength and maybe prevent atrophy, talk to your doctor and make sure that they feel that this is safe for you. I will put the article notes as far as where I found these articles in the show notes. So if you're curious and you want to read, you can Google those references and actually check out those articles or bring them to your doctor. There's the other question I get asked commonly, and I'm sure you probably have it now, is, well, which one should I use and which brand? And there's a lot out there. I don't know what the best is. I've done some research and looked into lots of the different supplements. The 2 most common that I recommend to my patients, one is a company called Thorne, Thorne, and the other company is called Pure Encapsulations. Both of these companies are very well-respected companies in the supplement field. They tend to produce very good products. They do testing to make sure that you're not getting contamination. Most of their products are free of allergens. But you can look into the products and figure out, which ones are best for you. I'll put, again, links to those products also in the show notes if you're interested in looking into it. And in the meantime, stay safe, eat healthy, be well, keep exercising. Thanks for listening. If you haven't already subscribed, please subscribe so you'll get updated of future episodes when they become available. And if you haven't already, please take the time to leave a 5-star review. It helps other people like you that are looking for topics like this find them on different podcast channels that you might be using. Until next time, I'm Adam Rosen. Thanks for listening to the Your Knee, Your Health podcast. Thanks for listening to the Your Knee, Your Health podcast. If you've not already done so, please subscribe so you'll be notified of future episodes. And if you enjoy what you're hearing, please take the time to leave a review. It helps other people like you find the show. I'm your host, Adam Rosen, and until next time, stay safe.